Check, check. Wireless, mic check. Wireless, mic check. 1, 2, 3, 4, 5. Press conference, mic check. Mic check, wireless, mic check. 1, 2, 3, 4, 5. Wireless, mic check. 1, 2, 3, 4, 5. 1, 2, 3. Check 1, 2, 3, 4, 5. Wireless, mic check. Mic check. 1, 2. 1, 2, 1, 2.
Good morning, everybody. If I could get everyone to go ahead and find a seat, please. And if I could get you to get your cell phone out and turn it off. Or to vibrate, that would be great. Pagers, too. We actually still have some of those. My name is John Moore. Good morning to everybody, and it is a pleasure to be here today. This is a very wonderful day. We want to acknowledge the news media. Thank you all for covering this. Your readers, viewers, and listeners will be very pleased to hear what you're about to report to them. We also want to thank everyone who is watching this live on Facebook, YouTube, and on the internet. Technology is pretty amazing, isn't it? We have some elected officials here that we want to acknowledge. We have some folks from Senator Cornyn's office, if you would raise your hands. Thank you for being here. Also from Senator Cruz's office. Thank you for being here. We have representatives, elected officials from the city of Lindale, if you would raise your hand. Thank you for coming. Gregg County elected officials. Thank you. And Smith County elected officials. And if you're an elected official and then I omitted you, raise your hand. Try to get everybody. This is a great day, and we're very, very excited about this. One of the biggest things in the history of our institution, probably the biggest thing. And I would first like to introduce the folks at our panel table here. Dr. Kirk Calhoun, who is the president of UT Health Northeast. Dr. David Daniel, who is Deputy Chancellor of the UT System, Dr. Ron DePinho, who's President of MD Anderson Cancer Center, Dr. Ray Greenberg, who's Executive Vice Chancellor of Health Affairs for the UT System. If you would, please welcome our President, Dr. Kirk Calhoun.
Good morning. You know, you've been around a long time when you can claim that you were on the search committee for all three of the folks who are sitting with me at the main podium here. And I'm going to deviate from the teleprompter right from the start. That seems to be the fashion these days. And talk about my tie. I'll take my badge off so everyone can see my tie. Reason this tie is important is that about a month ago, a group from UT Health Northeast was down in Houston at the 75th anniversary of MD Anderson. We were there with other MD Anderson partners from around the country to celebrate 75 years of that great institution. And as a gift, Dr. DePinho gave us these ties. By the way, it was not just a small group of us there. Also in attendance was former President George Bush, number 41, and Vice President Joe Biden and his wife Jill. And there was a lot of talk about the Moonshots program, and I'm excited about our campus being part of that as we fight to cure cancer. So I want to thank Dr. DePinho again for the beautiful, beautiful tie. Some of my other colleagues who are down there with me are wearing them today. And the ladies, you don't want to forget the ladies. The ladies at the event got these beautiful scarves. And if Jeanette, my lovely wife, you can stand, Jeanette, and show off the beautiful scarf that you got from Dr. DePinho at MD Anderson. So welcome. I am both pleased, excited, and honored to announce today that the University of Texas MD Anderson Cancer Center and UT Health Northeast are forming a partnership that will provide cancer patients in Northeast Texas with access to the most advanced cancer diagnostics and treatments available today. This is a very big deal for our academic medical center and a very big deal for our community. Our cancer program will be known as the UT Health Northeast MD Anderson Cancer Center. if you're going to pick someone to stand by you when you fight the battle against cancer in Northeast Texas, you can't pick anyone better than MD Anderson Cancer Center, the #1 cancer center in the United States, probably the #1 cancer center in the world. For us, here at UT Health Northeast, in just 5 years, the UT Health Northeast Cancer Treatment and Prevention Center has received accreditation with commendations from the Commission on Cancer. We are a Varian Center of Excellence, and we have entertained visitors to our cancer center from around the world. They've come from Brazil and Israel and Britain and many other countries and from all over the United States to visit our cancer center because they're asking, how are we going to fight the battle of cancer in smaller communities, in rural communities? And you guys have put it together just right. And we want to see how you're doing that. And they have duplicated what we have done here in Tyler in many areas around the world now. Our patients have come to our cancer center from 193 cities and 52 counties in Texas. And we have had patients come to our cancer center here from 16 states in the United States, have come and chosen to get their care here. Now, we are positioned to make a quantum leap forward in fighting cancer. MD Anderson has been with us on this journey all along. Today, we take the next very important steps in our relationship. I want to thank Chancellor McRaven. He wanted to be here today, but he had a higher calling from the Lieutenant Governor's office. I want to thank Deputy Chancellor Daniel, Executive Vice Chancellor Greenberg, and the UT system team for all their help and assistance. I want to point out Amy Shaw Thomas. Raise your hand, Amy, who is sitting right there, and she was a Vice Chancellor for Health Affairs at UT System. And when we first conceived of building the Cancer Center, it was a very risky venture on our part. And Amy, I will never forget this. You told me, well, you're just going to have to take some risk if you're going to make your campus great one day. And I really took that to heart. But the person who actually made me really understand it was Tim Arkren. Tim, where are you? Back here. Okay. Tim, so I'm talking about taking this risk. And so what Tim tells me is that, well, Dr. Calhoun, if you want to walk on water, you got to get out the boat. And boy, did we get out the boat. We had to swim a little bit. But we've really made some remarkable accomplishments with our cancer program. I especially want to thank, and this comes from my heart, Dr. Ron DePinho and his team of cancer fighters at MD Anderson. I want to thank my UT Health Northeast coworkers, and I want to thank our development board, our volunteers, and financial donors for their commitment and for their philanthropic success. The high quality cancer fighting equipment we have assembled here, some of the best in the world, could not have been done without their support and contributions. Finally, I realize that there are families out there. These families are sitting in the family room or perhaps sitting around the kitchen table. They're hearing about a loved one, a mother, a father, even a child, maybe a sister or a brother, an aunt or an uncle, who have been newly diagnosed with cancer. Uh, I know that that is a very difficult conversation. I know because, like all of you, Jeanette and I have personally been in those conversations. You pray for God's grace and you ask for his intervention. And you hope for options, options that will provide a path to cure. Families in Northeast Texas go through those difficult conversations every day. Maybe they can't afford a trip to Houston, or perhaps they cannot be away from their jobs or their farms for very long. Now, Northeast Texans have one more option, an option both closer to home and closer to the job. We here at UT Health Northeast are very committed to the needs of Northeast Texans and the needs of communities like ours, sometimes described as forgotten communities. We are so happy to join MD Anderson in the fight against cancer and to improve cancer survivorship and to end cancer in our lifetime. Now, let me pass the podium on to Dr. David Daniel.
Well, thank you, Dr. Calhoun. We've known each other for 11 years or so, and it's a real pleasure and honor for me to be here. On behalf of Chancellor Bill McRaven and all of the UT system staff members, let me thank you all for being here this morning for this important occasion. I want to start by congratulating Presidents Calhoun and DePinho for their leadership, forging an affiliation linking two of UT System's great institutions. And Kirk, you were talking about the necktie, but it's funny about how when you get into these positions with big things like we're talking about today, sometimes we notice the little things as well. So he noticed the ties. I noticed the logos. So universities have logo police persons who only sparingly, after hours of intensive meetings and conversations, allow their logo to be used because it symbolizes everything the university stands for. And that we see these two institutions' logos side by side, repeated over and over, is highly symbolic to me. I think it truly represents, at least visually, what these institutions are doing. And indeed, they are both taking some risks by taking this new challenge upon themselves to benefit this region. So if you haven't taken a picture of the logo, I'm taking a picture before I leave here, and I'm showing it to our own logo police back at UT System, saying, see, lighten up, folks. We are here to celebrate an affiliation that is going to do so much good for so many families, friends, neighbors, everyone who calls this region home. One of the things I've learned to love about working at the UT System is that we have quite a few hometowns: Austin, Houston, Dallas, San Antonio, El Paso, and more. But I'm proud to say that nowhere are we more enmeshed in the life of a community than right here in Tyler. I'm proud of the contributions of our two Tyler institutions and the contributions to the city and the region. UT Health Northeast is a critically important piece of the region's health and economic infrastructure. But let me acknowledge a fact that is too often forgotten. At the end of the day, whatever impact we have is a direct result of the vital local support we receive, not just here in Tyler, but in Palestine, Longview, Athens, and communities all over East Texas and even beyond. People whose love of Texas compels them to support our institutions. Your support is an amazing honor, one I can promise you that we don't take lightly and will never take for granted. We are working hard to be worthy of all that support, and in a sense, what we're doing today, announcing this affiliation agreement between MD Anderson and UT Health Northeast, is also a stamp of approval and appreciation for the entire community. The affiliation is fully aligned with the University of Texas System's guiding philosophy of our belief that we have an opportunity and a duty to make what we call quantum leaps on behalf of the people of Texas and the world. Across a broad spectrum of issues, from student success to brain health to national security to fighting cancer, the brilliant and dedicated people of the UT System institutions are ready to make a huge difference. But to maximize our contribution, we need to do a better job of scaling and leveraging our strengths, of working together, of driving collaboration at every turn, of learning from each other. If we can do these things, we can turn all the wonderful teams we have working on every problem imaginable into results that change lives for the better here in Northeast Texas and beyond. That's what today is all about. We believe that the bigger challenge, the higher the stakes, the more important it is to collaborate. And it's hard to imagine a bigger challenge with higher stakes than the fight against cancer. It's a disease that touches all of us in one way or another. It doesn't matter whether you're rich, poor, white, black, or brown. Where you live won't determine whether or not you get cancer, and it shouldn't determine whether or not you get the quality care you deserve. For many years, UT Health Northeast has been doing a heroic job of serving the people of this region, but we all know it's an uphill fight when the vast majority of Texas doctors are concentrated in our big cities. The affiliation between UT Health Northeast and MD Anderson Cancer Center represents an important step in addressing the disparities that exist today. And I have no doubt that all the brilliant professionals of both institutions, working side by side as a cohesive team of teams, are, in the near future, going to make a huge difference in the health and well-being of this region and its people. Let me close by thanking again Presidents Calhoun and DePinho for their leadership. And very importantly, thanks to all the doctors, faculty, nurses, researchers, administrators, and students at UT Health Northeast and MD Anderson Cancer Center. This affiliation is an idea whose time has come. So we're counting on you, and speaking for everyone at UT System, I want you to know that you can count on us as well. Thank you, and with that, I am very pleased to welcome to the podium the president of the University of Texas MD Anderson Cancer Center, Dr. Ron DePinho. Ron?
Thank you, Dr. Daniels. It's an honor to be here. Ray, thank you very much for the support that you've given from System. Your guidance, your mentorship has been instrumental here. I'd also like my team to stand up, so Amy and Maggie and others here that have helped make this happen. These folks have worked very hard to make this happen, so I want to thank them. This is a real team sport. I'm just so proud to be here. It's such an honor to be here. My admiration for Dr. Calhoun is beyond words. He is an amazing leader. I consider him to be one of the great healthcare leaders in the United States. He's certainly one of the great deans of presidents of organizations. He's an incredible physician, but he's also a very special human being, and it's just a privilege to have him as a colleague and as a friend. So thank you for your good words and your good work here in this community. Now, today is a very special day, not for two institutions, but for patients and families. Cancer is a disease that can strike fear into the hearts of patients and bring despair to families. But cancer also has a vulnerability, and that vulnerability is knowledge. The knowledge of what causes cancer in the first place so that we can prevent it.
the knowledge of understanding how to use technology to screen it so that we can catch it at its earliest, most curable stages, the knowledge of being able to diagnose it accurately and also deliver multidisciplinary care, the collective wisdom of many different physicians and healthcare providers to be able to have a patient give the best chances for cure. And this is a true revolution that's going on right now in cancer. Our knowledge of what causes cancer in the first place and how to detect it early and how to cure it definitively has never been greater. But that knowledge doesn't always reach everyone around the country and around the world. And MD Anderson's mission is to end cancer in Texas, the nation, and the world. And what we do is we reach out to other great institutions that share our commitment to make cancer history. Institutions that have the passion and the talent. And this institution is one such institution. It was a no-brainer for us to work with the great colleagues here so that we can synergize. And the secret is that it's not MD Anderson that's coming here and teaching, but we learn from you. We know that through this partnership, together, we are going to become stronger. We are going to become more informed. We are going to become more effective in being able to help patients here in Houston and around the world. So this is a partnership that's truly, truly synergistic. And the challenges are really great. Cancer is the most complicated disease to diagnose and to treat. 70% of the patients that we see come from other parts of the United States and around the world. Almost 1 in 4 diagnoses are inaccurate. Almost a third of cancers are misstaged. And if you look at the survival statistics of an institution like ours with multidisciplinary care versus other institutions that don't have the level of expertise, the survival statistics are 17% different at 5 years. And what that tells us is that institutions like MD Anderson and this institution have a solemn responsibility to make sure that we get the diagnosis right, that we use everything that we can, the technology, the experience, the knowledge that we have, to make sure that we give patients the best chances for curing this disease. And the tremendous opportunity exists today because this is truly a golden era for cancer. This decade and next will be a major turning point for our ability to tackle this disease. This is going to be our greatest contribution in a generation to really give the gift to future generations to be able to really say that we truly made cancer history. The knowledge of what causes cancer and our ability to prevent up to 50% of cancers. The technology that now exists in imaging and imaging physics, in blood-based biomarkers, enabling us to detect the disease at extremely early stages is upon us. And we have to make sure that folks are availing themselves of those evidence-based strategies to detect disease. The revolution that's ongoing in genetics, in genome, in personalized cancer therapy, in immuno-oncology to unleash the power of the immune system to create Lazarus results for patients that have failed standard of care is a reality today. But it's our responsibility, all of us here in this room, as a community that supports this great institution, as scholars who push the frontiers of knowledge, as clinicians and nurses and other healthcare providers that compassionately and competently deliver the care, to the administrators that support that infrastructure, all of us have a responsibility to make sure that we are saving as many lives as we possibly can and to really change the culture so that we can convert our disease care system into a healthcare system. So today is a great day for cancer patients and their families, and a very bad day for cancer. Thank you very much.
The impact of this partnership is far-reaching, and we do have some other speakers. Our next speaker is the chairman of the Tyler Area Chamber of Commerce. This is Mr. Claude Henry.
Thank you very much. It's my pleasure to be here and represent the Chamber of Commerce and the business community. As I look around the room and I see we have standing room only, this was a limited invitation event. I tend to think that if we would have had this at the largest venue in Tyler, it would still be standing room only because it's such a significant event today. You know, I think a lot of us in East Texas tend to forget that there are only 4 cities in the state of Texas that have both a University of Texas academic campus and medical center. And those are Dallas, San Antonio, Houston, and Tyler. So we are very fortunate to have the institutions here that are attributable to so many people that have worked for so many years to be what it is. I wanted to say that today's event obviously means that we're partnering with the world-renowned leading cancer care provider in the U.S., and now this is going to mean that the absolute best in cancer care will be available to East Texans, so that is really huge. The partnership will have a significant impact on our region, not only in terms of new job opportunities, but as well educational opportunities for our medical professionals in East Texas. The healthcare and medical services sector is the largest employer group in the Tyler-Smith County area. We have over 20,000 full-time employees and 10,000 indirect jobs that are tied to the sector. UT Health Northeast annual operating budget is over $200 million, and that has a major impact of over $500 million on our region of Northeast Texas. Today's announcement will enhance Tyler's reputation as a leading medical destination in Texas, and we're very proud about that. And I just wanted to say thank you to all of the decision makers who have brought this day to us. Thank you so much.
Well, we've heard from the medical providers, the administrators, city officials, chamber. Now we're going to hear from a couple of people who have battled cancer, are battling cancer. Our next speaker is a captain in the Tyler Fire Department. Proud to call him a new friend of mine. Met him recently. He is going to come up and tell us his story. He started the Turn Tyler Pink program, only to find out later he had cancer. This is Steve Countryman. If you would, welcome him.
Thank y'all for the opportunity to come today and speak and time to tell you my story. Back this last spring, I was diagnosed with a cancer that was caused by work-related exposure. Because of that, I was able to file on workers' comp. Unbeknownst to me at the time, it was going to start quite a challenge for me to find a doctor and a facility that would accept that workers' comp. But after many phone calls and conversations with friends, I was able to find a hospital that would accept it. And the only one that would was right here at UT Northeast. And I want to thank Cody and all of those responsible for that. It's been a great experience. I can say from the very first day when I made the phone call out here until I graduated this last Tuesday morning that I've been treated with complete compassion. I know that this is a great day for y'all. I'm very excited for everyone involved. And thank you for the great experience that I had here.
So did you get to ring the bell, Steve? We have a bell. When you graduate, just give him a hand. Our next speaker is a mom, a wife, former television journalist, and cancer survivor. She beat it not once, but twice. This is Leslie Roberts.
Thank you, John. You know, when John told me about today's announcement, I had the same reaction that you probably did here. Wow, a world-renowned MD Anderson wants to partner with us? And then I thought about it, and I said, and I thought about my care that I received here in my wonderful experience last year battling cancer, breast cancer. I thought, yeah, they're smart. They do want to partner with us. Yeah, good move. Don't get me wrong. I know the stature and reputation MD Anderson is bringing. As a former news anchor and medical reporter, I remember what seemed like weekly stories from MD Anderson about the latest treatment, a breakthrough in research, or a life-saving vignette of someone who had been told there is no hope, but they not only found hope, but treatment in MD Anderson. In fact, when I was told I had cancer for a second time, I decided I was going to interview the best hospitals in Texas, and I did. It was a tough decision, but you know what? I decided to have my treatment here. Because of my trust in Tim Ochran's expertise in designing a state-of-the-art cancer center, because of Dr. Bill Hyman's wonderful reputation and glowing recommendations, and selfishly because I wanted to have my treatment closer to home. You see, cancer patients need to be treated on several levels: physically, mentally, and spiritually. Being able to have my husband and friends drive me to chemo made all the difference in the world. And to have the beautiful place here, to have chemo where I was looking out at beautiful trees while I underwent hours of chemo, well, it set me up mentally and spiritually for success. And then the physical followed suit. The way my care here was tailored for me and adjusted so my quality of life remained important. Yes, this is a special place. So in the end, I believe this is a win-win collaboration for both, because both have so much to offer each other. And just think what this will mean for East Texas cancer patients. The access to cutting-edge drug trials alone is thrilling. You know what I found as a patient? Insurance companies do not want to pay for the latest cutting-edge technology. So that leaves cancer patients with three options. They either go into debt, they forego their treatment, or they find a trial that will allow them to get the medications for free. And they can also help with the new technology. MD Anderson brings those opportunities to East Texas cancer patients, and that is a blessing for us all. So I guess I should say this is a win, win, win. It is a win for UT Health Northeast. It is a win for MD Anderson, and it is a win for East Texas cancer patients. Let's celebrate.
Thank you, Leslie. The UT Health Northeast Development Board is a cohesive board, does a lot of work. They work together. So we're going to ask our two representatives from the development board to come up together. So our chairman and vice chair, Mike Allen, and Marilyn Glass, if you would come up and say a few words about what you think from your perspective, please.
This partnership creates a great new opportunity for the people of East Texas. The cancer patients now can have security and confidence that they are getting world-class treatment and they don't have to leave home. And they don't have to second guess their decision about, did we make the right decision about where to get our treatment? And they don't have to stay nights in hotels in Houston, and they don't have to be separated from loved ones. And that security and confidence will greatly contribute to their healing and their wellness. We are very proud of our historic relationship with MD Anderson, and we're excited about these new opportunities, and we're glad to be in the UT medicine system. It's a privilege. Last night I was thinking about right now, and my wife had gone to bed, and I started thinking about the chorus to the song Hallelujah. So I sang it, hallelujah, hallelujah. I sang it about 10 times, and Carol came in and she said, "What are you doing?" And I said, "Well, I'm practicing because I'm going to lead everybody in singing the chorus to Hallelujah." And she said, "No, you're not. You can't do that. If you do anything, you just say Hallelujah once." So, hallelujah.
Wow, I don't think I can beat that. But it is such a pleasure and a privilege to be a part of the UT Health Northeast Board. And as many of you may know in this room, my husband, John Glass, served on that board for many, many years. In fact, from its inception, he was probably, when I look across this room right here, he was one of the few that's still with us. He's not still with us, but that when it was on the inception of that, when that board was formed. And but he would be so proud today because he's a Longhorn, I'm a Longhorn, all of that, and he would be so proud to know about this partnership, see this unfolding with this fantastic, life-saving organization. It would be such a thrill to him, and we have a personal point of pride also because we have a son-in-law that is a research biologist at the research park in Smithville. And so he would be so pleased to know that we have this partnership here also. But it's a game changer. We've talked about, all of the wonderful things that are going to happen, but we live in the most unhealthy region of all of Texas. And we get those stats from UT Health Northeast, the wonderful research and whatever that they provide us with. And the mission of this hospital or this healthcare center is to really, as we had said before, to reach out to those 33 counties that don't have access to good health care. And so as a result, with this partnership, we're going to really be able to reach more of those folks. And so thankful for the leadership of this fella here and his team. And and so grateful to Chancellor McRaven and his team for making this happen for our community because it is a game changer for for the whole region of Northeast Texas. Thank you.
How are we on time? We okay for some questions? We are good. I got the thumbs up from the back. Okay, so for the news media, we will have a one-on-one and a completely separate opportunity for you in just a little bit. But if we have any questions for anyone on the panel from the audience? Seriously? Mr. Gleiser.
Thank you, John. This question, I guess, is Dr. Calhoun. Perspective of the Northeast Texas, set the index of capabilities and expertise. What degree does this institution, where on that scale would it fall, and what are the aspirations and the timeline for the aspirations?
Well, as I said earlier, if you're going to fight cancer, it's good to do it with the number one cancer fighter in the world. And, we went through, they're a big brother, but they didn't necessarily give us any breaks. They took us through an arduous assessment. I was just telling Dr. DePinho, I and my team here have a tremendous responsibility to the MD Anderson brand to make sure that the caliber of care here is equal to what patients would have an opportunity to experience in Houston. We can't do, and we won't try to do, everything that they do down there. And we'll certainly make sure our patients have facilitated access when those skills are required at Anderson. But I want you to just imagine that what we'll be required to do is we'll be following MD Anderson protocols for treatment, that we will make sure that patients have access, and this is very important to Dr. DePinho, access to MD Anderson advanced clinical trials, that our faculty and staff have met very rigid MD Anderson quality requirements. And probably the most important thing is the opportunity to work as a team. And physicians and scientists here will be able to interact, and we have big communications pipes between us. We do visual imaging down at MD Anderson, and they do it back with us with ease. We live in a world where you can be just about anywhere and have instantaneous communications. Our faculty and staff here will have that instantaneous communications with the experts down at MD Anderson, who will, in real time, be able to look at lab results, tissue slides, x-rays, and the medical record instantaneously and exchange critical information, discuss the best method of treatment. And then finally, when we identify that correct diagnosis, it's really key that Dr. DePinho talked about, and we initiate the right treatment. When we have those results, those positive outcomes, that goes into a huge database at MD Anderson. And they will take all the factors together with a big IBM computer. And that knowledge will be assembled so that we can better treat cancer around the world. That is the real strength of this relationship, because we're going to bring people who maybe aren't the typical MD Anderson patient because of our location. The types of cancer that we have here in Northeast Texas is a little different than the state average. We're older, poorer, much less well educated, and there's a higher risk of early death in our region. And so taking those factors into account and making sure that that data can now be analyzed will help us, and this is important to me as a medical educator, help us educate the next generation of physicians and nurses in what are the best methods to treat a particular cancer. So this is going to mean that we're going to be elevated in that way, that we'll be able to play in that game. Finally, just last weekend, we had a big cancer conference here, and the featured speaker was Dr. Garcia, who runs the Moonshots program at MD Anderson. And, he was telling Tim about our role, the role of this campus in the Moonshots program. We're going to be part of that. And Congress passed the 21st Century Cures bill this week that has funding to move forward and aggressively deal with cancer. And Tyler's going to be part of that team, part of that battle. And Dr. Garcia has already demonstrated that. The next step is Dr. DePinho and I have to jointly identify a new cancer center director. And I hope we bring someone to Tyler of prominence and stature that'll help lead this initiative here. I know the MD Anderson affiliation is going to help us recruit that kind of person. And people were working on it last night, and I can't wait to move on to that next step in our relationship.
If I might just add one point, that is that MD Anderson has an enormous amount of experience in this. And we have almost 24 partnerships throughout the United States. We have, on the research side, 33 sister institutions in 23 countries. And so we've learned from those experiences that we can dramatically elevate the quality of care if you have the right leadership, the right talent, the right institutional commitment. And I have full confidence that the quality of care here is going to be MD Anderson level care. And importantly, we're going to learn a lot from this institution as well. Some of the exciting things that we're talking about in early detection of lung cancer, for example, which is a huge problem here, we're going to be learning from our colleagues here, and that'll be an example where we'll be able to push the frontiers so that we can more readily diagnose lung cancer at much earlier stages when the chances for cure is greatest and so on. So there are going to be tremendous enhancements, not just here but our quality of care at MD Anderson will increase as a result of this partnership. And this is something that we have learned from experience. So it's not just a vision, it's not just a co-branding experiment. This is a true partnership where patients are put first, and we're always going to make the right decision for that individual patient as to what should be the diagnostic approach, the therapeutic approach. If they need a clinical trial, yes, there are some clinical trials that only exist at MD Anderson in the world. And so that patient, if that patient needs that clinical trial, they would have to come to MD Anderson. But as was said earlier, it is much better for the patient, for the person. Person is not just a cancer. Cancer happens to a person and a family. And part of that is the diagnosis, the care, and the support that surrounds the patient. And so it's important to appreciate that getting care closer to home is better for the patient. So if you can get the right diagnosis, the right care, and the right support, and have all of those things line up, it's going to be better for the patient.
All right. Can we get a round of applause for everyone on the panel? All right. Good news. There's food. So everyone is welcome to help themselves to some refreshments. They're just right outside either of these doors. If you are with the news media and would like to come down and get some interviews, we will facilitate those. And thank you. Give yourself a round of applause. Thank you for coming.